sterile technique, right? You're gonna usually see it in a box like this. Some hospitals, it'll almost look like a flat package. It won't be this thick, but it'll be maybe about half the size. Because some of the patients that you're gonna suction aren't necessarily the ones that are in the ICU that are intubated. You might be suctioning somebody out on the floor. As you look at the packet, this one says it's a 14 French. In the hospital, for adults, usually use 12 or 14 size French catheters. When we're going into a room, before you open up this and get started, you want to make sure you have your suction source, that it's on and it's working. So if I had this connected, have you guys all seen what a suction regulator and whatnot? Okay.
Yes.
So right, this piece is going to go, we'll imagine it goes here, and I'm going to have this end close to the patient. When I do this, I kind of wrap it around the rail of the bed because I don't want it to fall on the floor, because once I have a sterile glove on, I can't get it dirty. So we'll pretend this is the rail. The guy's neck. And before you open this, once again, you want to make sure when your suction is turned on, and the best way to know it is you're going to have, if you put your finger here, you're going to hear it kind of make a suction sound, or you're going to feel pressure. If it doesn't come on, there's a couple things to check. One, make sure that on the top of it there's a dial and it'll say regular, full, or intermittent. We want it on regular. At the base is where you adjust the pressure, because maybe the pressure isn't set to that negative 100, 120. There's also on a canister, on the back side, there's a little knob, and it'll actually say on or off. So make sure that's turned on. This is just all extra information, but start to think. Final thing is sometimes the canister will be full and then it won't give you any suction. So before you ever get on sterile gloves, make sure your suction is working. Okay. I also want to make sure that I have some lubricant. We'll just pretend that this is it. So I've gone in, I've sat my patient up. I've told them I'm here to help get some of the congestion out of their lungs. I'm going to open my packet, and when I do so, there's this little white area, and that's our sterile gloves. Okay, everybody see that? When I lift this out, I want to make sure that I don't touch the catheter that's underneath it. So I'm taking out my gloves. I'm going to put this down. I'm going to open them up. Now the sterile part is inside, right? Everybody sees those little blue gloves, so that's the part that I don't want to touch. So I'm going to fold back the ends, and a lot of times I'll have the patient tray table next to me for a spot. I'm going to grab these corners. Can everybody see these corners right here? I'm going to open it up, and if you need to, you know, you might have to work your hands up a little bit to kind of fold it out. And I'm okay touching just the outside edges. If it folds back, you just kind of fold it again. So where did I? So if I have my lubricant, I'm going to tear open the package and I'm going to squirt it into a little bit of a corner there. Okay. So I'm just pretending. I'm right-handed, so I only put a sterile glove on my right hand so that I remember this is my sterile hand. This is my hand that I could hold the patient's head down. I could answer my phone if I had to. Worst case scenario, this is my sterile hand. So on these gloves, there's a part at the top here that's kind of folded back that I can touch. I can't touch down here because this is sterile. So with this hand, I'm going to stretch it open. And one of the hardest parts is finding where the finger holes are. So if you are doing this, don't worry, you can kind of hold out here on the side that's still kind of folded back as you find where to put your fingers. And if you get more than one finger in a hole, you're still just, I'm reaching under and stretching it on. Okay, so now this is my sterile hand. I'm going to reach in and get the catheter, and I'm holding it right here. This white part is the thumb port. So I can hold on to this with my, what we'll call my dirty hand. And what you want to do is wrap this around your hand, because now, once again, if my phone or something crazy goes on, this is still sterile, right? This part I can touch. Sometimes when you take this out of the package, it's going to be kind of stiff. So what I've gotten into the habit is just kind of manipulating it just a little bit to kind of warm it up and get it more flexible. You don't have to do it, it's just something that I've done. Then I'm gonna go ahead and wrap it back up. I have my suction that number 1C and I made sure was on. And I'm gonna connect it down here. I can go all the way down to keep touching that catheter, but I can't touch that thumb port. Okay? Now when suction is on, if I occlude here, you're gonna actually feel the suction. Okay? This is where now I'm gonna keep just a couple inches out. I'm gonna dip it in the jelly, KY jelly or whatever your lubricant is. And I'm gonna go to the patient and I'm gonna see which nerve that I think I can get through. Sometimes people will occlude one side and say, try to sniff in, or ask the patient, do you have a deviated septum, or have you ever had your nose broken? Or a nurse will already have an NG in one of the nares. If the patient has an NG, that nasogastric tube, you can't put the catheter down there. So I'm gonna put in the catheter. And sometimes if you hit some resistance, you kind of give it a little twist. And you're gonna get to a point where you're gonna hear actually a change in breath sounds through the thumb port. You'll kind of hear like somebody's taking a breath in. When you hear that sound, then that's when you advance the catheter even more in the real world. And they'll already be coughing. Then I occlude the thumb port, I pull the suction catheter out, and I wrap it back up in my hand. I let the patient get a breath. Pre-oxygenation. So in the ICU, a lot of times they do the bag and the ambu bag. On the floors, a lot of times we don't. If a patient's wearing a nasal cannula, you'll see them put the nasal cannula in their mouth so that they're still getting some oxygen. Should you have an ambu bag, if it's somebody who you know has been sick or has a problem with oxygenation, then yes. But is it something you're going to see all the time? Unfortunately, no. If I was suctioning and all of a sudden I hit the cheek, this is a dirty catheter, I have to get a new one. If you're getting somebody who's kind of combative, take a nurse in there with you and ask them to help restrain the patient, because you are going to get people, somebody, like I said, that is awake and alert, and they're going to be thrashing around, they're going to be trying to grab at you. So sometimes you actually have to kind of come up from this angle and try to get the catheter in. If you can't get it down one side, go back, lube it up, try to go down the other side. If you hit a lot of resistance, then you stop. So how do you know how far to put the catheter in? A lot of times you'll go down until you get to a little bit of resistance after you've heard that change in breath sounds through here, because what that means is you've gotten past the glottis and you're actually down into the patient's lungs. I'm not going all the way down into the lungs, I'm kind of going probably more to the carina. And there's some patients, when they have a lot of secretions, they can cough it up to kind of the back of their throat, but they can't actually clear them. So that's where we would do this. Does that make sense? Yeah. Remember, we have this other piece of equipment and a nasal trumpet. How do we size this?
From nose to
the ear.
Right. So we're gonna see this. This would be about the right size. While we're here today, you guys practice putting it in. Remember, this is, once again, you'll kind of lube it up. You'll put it in the patient's nose and you'll say this is going to be a little bit of pressure or a lot. We're going to lube this up. This would go down. So if this is a 30, I think this is a 30 French. The cheater way is to just kind of divide it in half. So half a 30 is 15. I have a 14 French. That's still kind of a little bit bigger. A 12 would be better, but this will go down. But you can see it's kind of filling up that whole tube. So now if the patient needed to try to breathe around this as well, there isn't an opening for them. So that's why we would go down to a 12.
Now, obviously, there's different sizes of the NGs, so not the
Nasal
NG,
trumpet,
but the nasal trumpet.
You'll see 28s, 30, and 32 most commonly.
Okay.
But then, if you had a time where you needed to get a sputum specimen? You guys have a Wilkins strap in here?
I'll go grab it.
So once again, if all of a sudden I'm sectioning and they're like, oh wait, we need a sputum specimen, you're gonna have to try to figure out how to get this off to put this in here and keep this clean in the meantime. But like I said, you're gonna get some patients that are gonna fight you. So you'll have to learn how to kind of dodge people and sometimes I've stood on their restraints, you know, they'll have their restraints tied to the bed, so if you stand on it. If you see the yonker coming out of the patient's mouth, obviously we need to pull this back and try to advance it again, because you'll see that sometimes their tongue will kind of start to get the back of this, and so it'll come out their mouth. Pull it back just a little bit into their nose and go ahead and try again. Thank you. So it would look like this, right? I would suction when I include my thumb port. Now the secretions are going to go into this little canister when I think I've gotten a fair amount. And once again, I'm going to take this off. And this would go on here. And if you can't get it, like I'm having trouble here, then you can just put it down and get back to it later. Okay?
Okay.
But practice is, one of the trickiest parts is just getting the gloves on and keeping this thing clean. The first couple times you do it, especially if a patient's awake, you're gonna be nervous, your hands, you're gonna put your thumb in one of the pinky ports and
Yeah.
it's notorious. And then when you're done, you just peel it off over the catheter. This goes in the trash. You make sure your patient's doing okay.
Well, if you know, it's a good point. If you know those gloves don't fit your hands, then you get a pair of sterile gloves, and we have them. They're in the cupboard above the sink. Because in term 4, you're gonna learn how to do sterile everything.
Well, usually these are bigger than anything else. If you have small hands, then you'll have like extra material to spare. It seems like they always are bigger than small.
I've seen them break a lot.
You've seen
Them break.
yeah.
Yeah, so you could just get a regular pair of sterile gloves in the back, and then you would just open them the same way. The other thing is when you guys send your sample, if you don't have enough secretions from the lungs, they check for the cells, and they'll send it. They won't accept it, and they'll tell you that it's saliva and not an actual sputum sample. So that's something to keep in mind. That's probably to come from the lab. The other thing, I know, Mr. What?
There was one. Go
ahead.
Oh, so sometimes you're gonna have to rinse the catheter between passes. So if you have a little basin like this, or some have a little, looks like a cardboard box, you would open it, you'll squirt some of the saline bullets in there, and you can, when you have your catheter, suction it through there, and then that cleans it.
Sorry, Ms. Sharon.
Yeah, some of them have the basin, some of them don't. For the boards, I know Mr. C told you one thing. I thought he was going to tell you this one, but the proper suction catheter size, it's ET tube times 3 divided by 2.
Nice.
Okay.
That's how you do it from now on.
Yeah. Ours was times 2 minus 2.
Yeah,
Minus 2.
whatever it is,
I
don't.
don't even remember now.
Yeah, use this one.
Times
ET
3.
tube times 3 divided by 2. So if your suction catheter, if your ET tube is an 8 or your trach is an 8, it's 8 times 3, it was just 24, divided by 2 is 12. So you would use a 12.
Okay. That makes
So
it.
that's how you know. Because sometimes your questions will be like, you can't suction and you're using a 10 French catheter and you have an 8 size ET tube. Well, your catheter is too small, so you should switch to a 12. Other times the questions might be that you're suctioning, you can't suction. You have a 12, you have a size 8 tube, so you have the proper suction catheter size, but the vacuum's at minus 80. So what do you have to do then? Turn up the suction pressure. So those are the things you'll see about that. So you're gonna get checked off on sterile suctioning too at some point. So make sure you practice to do that. We're bringing the suction machines in so you can see how the canisters are, make sure that you can hook them up. This is of course the old easy vac version, but the canisters are still the same. So you have to cap them when they come, they have everything is off. So you have to cap things, know to put your suction here. You can regulate the amount of suction when you push on your, either put your thumb over the end of the suction tubing or put your thumb to include on the catheter. You can check your suction pressure. That's how you can see what it's at. So that'll help too. Troubleshooting, making sure all your connections are on there, you have your containers, all that. So you'll have those, if you wanna get a little cup with some water to actually practice suctioning, make sure you practice with your ballards. So you guys have lots to work on today. So, go ahead and get your boxes. The two of you